This is Doug Sparks, the founder and CEO of DPT Healthcare Partners, and you got an award for one of the top 10 smart healthcare companies on behalf of your company. Tell us, what does your company do?
We manage ancillary services for hospitals, physician groups, IPAs, ACOs. The problem with the ancillary service business is that your patient compliance is only about 20%. So when you send someone out the door to go do something, they don't do it, 20% do, then you don't get the outcomes. So every physician's EHR tells them what the patient's doing in their office, but then this year CMS says 50% of your compensation is based on provable outcomes. So why are you not getting any outcomes? You're not getting because you have no participation outside of your office.
So what are you doing? You spanking them on the butt?
No, we actually set up systems and put them in place so that orders go directly to the places they're going. They're called and said your doctors ask us to remind them or to let them know when you've made your appointment, you're scheduled. So we can take, for instance, on average, like for instance, physical therapy, 23.8% go to physical therapy. Well, the reason they go is because they have a prescription and the doctor knows it has, but the therapist doesn't know. So we notify the therapist that the patient's coming. Therapist calls the patient and says, your doctor's asked us to contact you when you've made your evaluation appointment. So we can turn that 23.8 into 68 to 71% attendance.
And this is all done on an app? Well, how's the system?
A combination of things. We've got a portal that we work with. We've got a number of tech companies we work with. One of them has a combination. It's like a crossover between Facebook and LinkedIn, where if you're the physician and you're sending, or sorry, I'm the physician, I'm going to send you a patient, I would send you in the essence of a friend request, and you would accept that request, and when you did, you would immediately, I would send you over the EKG, or I would send you over the MRI, and any activity that you had with that patient would show up on my portal. I would know what's happening. That same system can prompt the patient. It can give them a phone call and see if they were compliant to a visit. Did they take their medication? It can trigger a telemedicine conference. It can also trigger a video conference.
How did you come up with this? This sounds amazing and life-changing.
Well, what we do is we're trying to solve problems, and the big problem is for these doctors is that how can I get outcomes? So we found this company that did this, and we do this all the time, and we ask them to take their platform and modify it to do what we need done. And so they're happy to do it because, for instance, that particular company, they're in the chronic care management chronic care management category. The problem with chronic care management is it's only Medicare patients, small percentage of your population. It's a very low margin for them, profit margin. So when they start checking and managing outcomes for us, now they can contact all of the patients in that physician's practice. So they gives them a door to the commercial aspect, and then we share revenue with them for services that they send them to.
Thank you so much. No wonder you got the award. So very nice to meet you. Thank you, sir. Bye-bye.